This year's World AIDS Day theme is Let Communities Lead, placing communities at the forefront of confronting the barriers that are driving the global HIV pandemic further. The national commemoration is taking place in Ngcedomhlophe Sports Field in Mandeni Local Municipality in KwaZulu-Natal. SABC News reporter Vusi Khumalo is there and now joins us live. Vusi, good morning. Thank you so much for making time for us. Tell us about what you can see currently and what to expect on the program later today.
Yes, good morning, Aldrin. Yes, indeed. We are here at Sundumbile at a ground called Ngcedomhlophe. It's an area that is on north coast of the province of KwaZulu-Natal, just about an hour drive from Durban. Yes, we are expecting the Deputy President of the country, Mr. Paul Mashatile, to officiate this program known as World AIDS Day. As you know, that today being the 1st of December, it's a world commemoration of the World AIDS Day worldwide. As you know, that a number of countries are trying in their efforts to ensure that they do cap the spread of HIV, with South Africa having the biggest numbers, the high rates of HIV infections worldwide. And I must also say that there are some strides that have been made in order to cap the spread. But one thing that has been a disadvantage to the efforts by the South African government is the drop in the condom use and also the high rates of HIV AIDS among young women and also the teenage girls. But to talk us further about the day, how it will unfold, we've got a guest here from the Department of Health who's going to tell us more about how the day will unfold. If you can perhaps introduce yourself, sir, and also tell us about the day, how will it unfold from here. We know that there are some dignitaries that are also expected on the day, and also about the theme that is being discussed today, Let Communities Lead. What do you mean by that?
Good morning. Thank you for the opportunity. My name is Petros Khoza Ntabiseng. I'm from the National Department of Health. I am the acting head of HIV and AIDS program in the National Department. Today we actually gathered here in KZN to come and commemorate the World AIDS Day. It's an annual event that we get observed and commemorated worldwide. So we are part of the international community. But the relevance in terms of coming to KZN today, it's more about that of reminding ourselves and the country and communities to actually get to say that much as the country is doing quite well in terms of curbing the spread of HIV and AIDS and actually arresting the new infections, they are actually dropping in terms of what we're seeing coming through, but there's still other work and tasks that we still have to achieve. One such is what you just referred to earlier. It's issues around much as we're seeing that prevalence is actually holding, but incidents is actually still happening. I mean, there's still transmissions that are taking place, especially amongst the youth 15 to 24, mainly in the female category of that population. So today, in terms of Let Communities Lead, the theme of the World AIDS Day as we commemorate, it's we're saying Let Communities Lead, because we think that we're at the point where we're supposed to actually ensure that as health only or as government only, we actually are not going to be able to really do this last mile that we have termed, because maybe if I may explain the last mile concept, is that worldwide, internationally, the caseload of HIV is about 39,000, about 40 million, about 39 point something million. The proportion of that is in South Africa. The biggest proportion in South Africa, we estimated PLHIV is around 8 million people living with HIV. Of those, we actually currently, as we speak, have about 5.8 million of PLHIV knowing their status and actually on treatment. But there's still a gap. In terms of the gap is that we still need to then find these members of our population who are HIV positive but don't know their status, and then get to test them and put them on treatment. So unlike in the past, I'll say past 10 years or so, the issue there was that we would find people, patients would pitch in our facilities or will have activations like this one or in taxi ranks or anywhere else, and then we'll just offer HIV tests to people and they'll test. So we think that the biggest proportion of those category of people have actually been taken care of and are on treatment. Now it's having to find those who would not likely come for health-seeking behavior, or we've got to then make sure that we actually find all avenues that can be able to help us do that. So with this around communities lead, we actually are going now to communities and we are asking them to be part of the response in South Africa to help us really to find all these members of the population that I referred to that we need to find and put on treatment.
With 2025 just around the corner, just 2 years away, are we still going to meet these targets that has been set worldwide for countries such as South Africa to meet this 395%?
Yeah, so we are actually on course to meet the 95, 95, and 95s. So the first 95 in terms of PLHIV living and people living with HIV knowing their status, we actually are on 95 as we speak. So the data that we have now, it says 95. In KZN specifically, just as a province, they are already on 97% in terms of the first 95. Where we have a biggest challenge is on the second 95. The second 95 is that of then having those that are HIV positive then put on treatment and remaining in care. So the challenge that we have is that we actually, much as we actually find them and put them on treatment, the challenge is that sometimes the issue around retention, and for one reason or another, it could be that people are moving, they move from one place to another and all that, and whatever social reason that might be, that's what we actually need to deal with. When we look at the data, it suggests that because we already are at 95% of PLHIV knowing their status, so the pool of those patients that would we call them naive, that would not necessarily have known their status before and therefore will know their status and be on treatment. It's actually not as high as those that actually have been put on treatment and for one reason or another have disengaged treatment. Those are what we need to go and then find and bring them back on treatment so that then we retain them on treatment. With that, then we'll be able to reach the second 95. Hence the reason why we feel that we need members out there, community structures, whether it's churches, be it the social clubs, be it any other formation, churches and all that, to come on board really to help us to ensure that we encourage people that are put on treatment, that are currently on treatment, to remain on treatment, but those that have disengaged to come back to our facilities through what we call the Welcome Back campaign, to come back on treatment and re-engage on treatment so that the number can go up. The third 95, we actually are on the 93% in terms of viral suppression. So that we actually are doing quite well. When we actually can find these ones that we need to find on the second 95, then surely the 395s are going to be met. So with the Minister of Health, the Minister has actually introduced what is called the 100 facilities. What we have done is that instead of just shooting in the dark, we actually are very clear in terms of knowing where we're supposed to go. So we have identified in South Africa of the more than 3,000 public health facilities, the 100 public health facilities that are carrying the biggest burden of HIV or that have the biggest prevalence of HIV in their catchment population. And that's the areas that we're focusing in. We're focusing on those facilities to ensure that we encourage communities around those areas, but also even the facilities, just to check on their records how many patients they once had on treatment and have they actually gone down or lost some patients, help them to find the patients and re-engage on treatment. And that way we are able to actually get back our patients that are supposed to come back on treatment.
Being the World AIDS Day today, how important are such awareness programs in terms of achieving your second 95, which you have said that it's a bit of a problematic one?
It's quite critical that we actually do have the opportunities like this to share with our communities to really say that the country is actually doing well. We are well on our way to be able to really meet the 2030 target of having what we call the HIV-free generation. So that is possible. It looks achievable. The only way we can be able to do it is if actually we have the whole community approach, kind of, rather than it being left to being a government problem or more specifically a Department of Health problem. But it should actually be a challenge or something that we actually gear ourselves up to actually ensure that we get there. One thing that we are very happy about is that we are now partnering more closely than before with our communities and structures that are dealing, NGOs that are dealing, that are formed by people living with HIV, like TAC, Sanarela, NAPWA, and much more of those facilities, even at community level, because it takes those that are on treatment already to be able to share with those that actually were on treatment and have disengaged, or those that are recently tested or identified as HIV positive, to bring them back on treatment, but also to encourage them to say, look, I'm walking the journey, we can walk it together. We've got adherence clubs, we've got what we call support groups in communities as well, so that we are then able to really gear ourselves up to be able to get there. So the opportunity today with our Deputy President as the chairperson of SANAC in South Africa really is going to be on this day giving us a message in terms of again reminding South Africa and the world really in terms of where we are, the strides that we have covered, but also the challenge that still remains, that we need to be able to really mop up about 1.2 million people living with HIV in South Africa that have to be put on treatment, and we then are going to be able to meet the second 95. Just in terms of data, lastly, the issue that we had on the 95, so when we started with the 100 facilities project, in April this year, we looked at the figures, and we found that the gap that we still had to find was about 1.2 million people in South Africa. The data that we have from September, just from April to September, suggests that we already have found about just over 200 patients on that were not on treatment or either had disengaged and are now back on treatment. So the gap is actually narrowing down because we now have a focused kind of approach. So the Deputy President with civil society, the Minister, the Premier today are really going to be engaging the communities to ensure that we actually remind and spread this message to say we can be able to achieve that.
Thanks a lot for your time, sir.
Thank you.
Cheers. That's Mr. Khoza from the Department of Health saying that it's a bit of a problematic one for South Africa to ensure that those who have been found to be HIV negative are also put on treatment. He's saying that's about 1.2 million people, but they are also making some strides in terms of narrowing that gap to ensure that there's no one who doesn't know their status, and those who know their status of HIV and AIDS are also being put on treatment. Eldrin.
Thank you so much, Vusi Khumalo, there in an area called Ngcedomhlophe, where the official commemoration will be taking place.